Well, welcome everyone. I'd like to welcome you here today to the launch of the ACT Mental Health and Suicide Prevention Plan. And I think today's weather outside is very fitting. It's a very spring day, so it sort of feels like, it's symbolic of how we're going to spring forward in terms of the provision of mental health services in the future. For those of you that don't know me, I'm Megan Carl. I'm the CEO of Capital Health Network. Unfortunately, Auntie Ros isn't able to join us today, so I would like to acknowledge the Ngunnawal people on whose lands we're meeting and to acknowledge their elders, both past, present and emerging. I would also like to particularly welcome the ACT Minister for Mental Health, Shane Rattenbury, and I would like to acknowledge all the people and organisations that have worked together to develop the plan. Finally, but most importantly, I'd like to acknowledge the people with lived experience of mental health illness, their carers, and the mental health workforce. Due to the COVID-19 physical distancing restrictions, we've had to limit the number of people who could actually attend in present today, but I'm pleased to say that we have many people watching today's launch via YouTube, so if that's you, I'd like to welcome you as well. The ACT Mental Health and Suicide Prevention Plan was developed to improve mental health outcomes for Canberrans and people in our capital region. It was developed in consultation with key local peak organisations, the ACT Mental Health Community Coalition, the ACT Mental Health Consumer Network and Mental Health Carers Voice, and I'm pleased to see that a number of their representatives are joining us today. It was also developed with government organisations, including the ACT Health Directorate, the Office of Mental Health and Wellbeing and Canberra Health Services. The plan was supported by funding from the Capital Health Network through the Australian Government's Primary Health Network program. A key feature of the program is ongoing collaboration, and I think a key component of this plan has been the fact that we've been able to get all of the stakeholders together around the table, albeit virtually towards the end, and existing, I think it's a great opportunity to promote how we can better plan and develop services into the future. The plan acknowledges the challenges facing us as a community, but I think importantly outlines what we'll do in partnership to improve mental health outcomes for Canberrans. And our key focus will be ensuring that services are person-centred and integrated. People will only have to tell their story once. The ACT Government, Capital Health Network and local peak organisations will work together under the plan to both plan and fund mental health services, which I think will be a first and again is very exciting. And we'll also work together to build the capacity of the system and improve the coordination of activities. The development of this joint regional plan is a requirement of the fifth National Mental Health and Suicide Prevention Plan. So each PHN is working in collaboration with its stakeholders to develop such a plan and ensure that it's fit for purpose for their region. The approach that we've taken in the ACT was to join with local peak bodies and government to develop the plan. And we felt that it was important to do this because it incorporates a whole of system approach that integrates the voices of those with the lived experience. I think this program has probably had the gestation of an elephant, if not longer, and that's because it was really important that we consulted thoroughly through the development of it to ensure that we were reflecting the community and those with lived experience. The plan consists of three elements, the first being the framework, the second being the implementation plan, and the third being performance and monitoring. There are 7 areas of focus for mental health in the ACT, and they are improved mental health outcomes for everyone, services that are responsive and integrated, a highly skilled and sustainable mental health workforce with higher mental health workforce retention, early intervention in life, illness and episode, whole-of-person care, reduced self-harm and increased suicide prevention, and improving the social and economic conditions of people's lives. As I've said, the development of this plan has been a true collaboration. We've partnered with organisations who are committed to improving mental health service, improving the mental health service system and mental health outcomes in the ACT. So we're going to take these organisations to form a steering committee, and that will review and update the plan regularly throughout its 5-year lifespan. Each organisation is going to develop individual and joint work plans based on the activities that are their responsibility within the plan. And I understand that Dr. Elizabeth Moore will tell you a little bit more about what the Office of Mental Health and Wellbeing will be contributing in that element. So the steering committee will provide annual implementation updates to ensure that we're keeping each other honest and remaining accountable to the community that we're providing these services to. In terms of CHN, mental health is one of our key priorities in our business plan for this year. And as part of that business plan, we've committed to 3 key activities. The first being an adult mental health centre, which will be an integrated hub that will essentially provide no wrong door in terms of entry and will be focused on providing services to adults, and we will work with the Health Directorate and Canberra Health Services to ensure that this hub complements and doesn't duplicate services that they're providing. We're also working on integration projects, and I've just literally come from a meeting with Woononga to talk about how we can work with them, and also with agencies such as Meridian for the LGBTIQ specific services. And over the next year, we'll be working on integration projects for the child and adult mental health. Finally, we're working on data partnerships with Canberra Health Services and ACT Health Directorate to assist with identifying gaps in services, adhering to key outcomes in the plan, and planning for new services and community need. Before I finish, I think I don't need to remind you, but I think it's worth considering the current and unusual climate in which we're all working and living. And I think our experience of COVID-19 and the social isolation that has created, we do anticipate to see an increase in the need for mental health services in the community in the future. And I think as we implement this plan, it will be important to be cognisant of that and adapt it as we need to. Finally, I would really like to thank all of those that have contributed to the development of the plan and will be part of the lifetime of the plan moving forward. The contribution from the community in the development of the plan has been invaluable, and I think provides us with a great way forward. I would now like to introduce Dr. Elizabeth Moore, who's the Coordinator General of the Office for Mental Health and Wellbeing.
Sorry, I've been working from home and it's the first time I've worn heels in ever so long. So, thank you, Megan. I too would like to formally acknowledge the traditional custodians of the land on which we meet, the Ngunnawal people, and pay our respects to their elders past and present, and the elders of all cultures gathered here today. I'd also like to acknowledge people with a lived experience of mental illness and the work that they inform. So the Office for Mental Health and Wellbeing was created because there was a recognition that positive mental health and wellbeing is more than clinical service delivery. It requires a cross-government, cross-clinical and community services response and a whole-of-community response. It's complex. It requires collaboration, and I think this plan actually shows the value of collaboration, and never more so than in a pandemic. We've all learnt to be agile. We've all learnt to use what we already know, and I think that's the important thing. Although this plan sets the framework out till 2024, it's not as if we haven't been collaborating. And I think that's really important. The office had a co-design framework from the beginning, and that co-design has been informed by community, by different directorates within the ACT public sector, the Commonwealth, but most importantly by community services and by community. We need to get across the continuum in order to get some of those outcomes that Megan has talked about. So very much in mental health promotion and prevention, very much in early intervention, early access to services, rehabilitation and recovery. But we can't do that without the broader socio-economic determinants. So what do people want? They want to have the ability to live a meaningful life. They want the ability to have a job. Good relationships. Some of those things we can't do without community. I wanted to talk a little bit about the Children and Young Persons Review, because this is a good example of how to co-design. And gosh, young people are not backward in coming forward about what they want, what we've got wrong, and what we can do about it. But we now have money for a youth navigation portal, and that talks to some of that difficulty of actually getting to service delivery. And we're designing that, not only with our non-government partners and with government partners, but also with young people and their families. Some of the other things that this fabulous group that's got together to put this plan together is also doing comes across in trauma-informed care, changes in the workforce, looking at a peer workforce, looking at different workforce. How do we get the consumer voice in most of the things that we do? We're looking at gender-affirming standards of care, because we know in the LGBTI community that there is a vast range of mental health issues which we can do something about. And this will be happening. The implementation of the plan goes to 2024. It's really important that we're able to monitor this. So we need data. Data is key, and it's something that governments struggle with, both Commonwealth and state, and also non-government agencies. So outcome data is very important. It's what's important to the people that access services, and it's what's important, I think, to all of us. I'm very pleased to be able to say a few words. The Office for Mental Health and Wellbeing will continue to consult. We will continue to have a co-design process. I understand that during Mental Health Week there are some community events that are being planned so that there could be further consultation and conversation around the regional plan. I'd like to particularly acknowledge the organisations and their leaders that have helped to make this plan. So in the ACT Health Directorate, the DG of Health, Kylie Jonathan, and the Mental Health Policy Unit. In my office, Leanne Rogers. Lisa Kelly from Carers ACT. Simone Veriek from the Mental Health Community Coalition. And Darlene Cox from the Mental Health Consumers Network. I'm looking forward to continuing to collaborate on this. I think we have a real opportunity to make a difference for people in the ACT. Never more so than now, with our COVID agility, we are going to collaborate even more because there is no option. We cannot do this singly. We must do it together. Thanks, Megan.
Thanks, Elizabeth, and I'd certainly like to acknowledge the wonderful leadership that Elizabeth has made to the process of pulling this plan together, and from my perspective, really looking forward to working with her and her team in terms of the implementation of the plan. I'm now absolutely delighted to welcome Terry Warner, who is going to give a consumer perspective on the regional plan. Thank you.
Now, I'd never be forgiven for forgetting to introduce myself. For those of you who don't know me, I've just spent 4 years as the chair of the ACT Mental Health Consumer Network. I have spent most of my career as an advocate focusing on consumer participation in healthcare and particularly in mental health. And I suppose you could sum up my career as an advocate as a long journey where all I really say over and over again is you need to ask the obvious people the obvious questions. People who are affected by the decisions that you make need to be involved in making them. You need to ask the service users, the consumers, the carers, what matters to them, what's important, how the changes that you're proposing are going to affect them. And with respect to this plan, that has been done. There has been consultation, there's been collaboration. But having said that, I think that the broad consumer perspective on the plan can really be summed up as it looks good, but ask us again in 2024. And I suppose there's a bit of context that I need to give you for that. So in my lifetime, and I'm now 38 years old, the mental health sector has been subject to rolling reforms. Most recently, the parallel reforms brought about by the Fifth Plan and the introduction of the National Disability Insurance Scheme. And those reforms have been characterised as having sound underpinning principles, but problems with implementation. So in a national context, we started with a program of deinstitutionalisation that really came out of the Second World War. And that led to inadequate replacement services, as well as significant unknown, unmet need. And what it really was decommissioning an old model of care and then trying to replace it. That failure of implementation led to the National Mental Health Policy, which then led to the first National Mental Health Plan. So the second plan, the first plan was largely to address the problems created by deinstitutionalisation, and by deinstitutionalisation I mean the closure of the standalone psychiatric facilities, which, to be fair, still hasn't actually been completed nationally. So the second plan really addressed mild and moderate mental illness and prevention and early intervention. The third plan, you looked at workforce and service integration, and it was widely criticised for trying to address the cumulative previous priorities that hadn't been addressed up to that point. And now the fourth plan was all about regulatory measures, but it was kind of eclipsed by the COAG plan, which is what the fifth plan came out of. And of course, the plan that we are launching today comes directly out of and is, as you said, it's a requirement of the fifth plan that we have a regional mental health and suicide prevention plan. The thing is that these plans that we've seen at the national level and at the state and territory level largely, historically, have amounted to policy success in the presence of systems failure. Now, I'm not saying this to in any way denigrate the plan. You asked the right people. You said the right things. And I strongly believe that you get it, that this plan understands where we are now and what a better journey would look like for a person in this system. But my question has to be, can you deliver? Can you produce a trained workforce? Can you integrate all of the necessary systems? Can you get the funding? And is what you say you are going to do what you will actually do? Speaking as an NDIS participant and a long-term mental health consumer, I've actually reached the point where I'm not only asking you, are all of your ducks in a row, but also, are all of your ducks actually ducks? Think about the introduction of the 2015 Mental Health Act. Now, 2017, the Australasian Journal of Psychiatry published a review of all of the mental health legislation in Australia, and the ACT came out on top solely on the basis of the rights-based provisions in the Act. So those are your advance agreements, advance consent directions, and nominated persons provisions. And we are still, in 2020, struggling to implement those in a way that is effective and that is helpful for consumers and carers. That is a piece of work that is ongoing. Not going to say it's failed in its implementation yet, because there are things that are happening. There are great things like the Mental Health Consumer Network's My Rights, My Decisions program. There is collaborative work happening between Canberra Health Services and Mental Health, Justice Health and Alcohol and Drug Services and consumers to make sure that these things are in place. Still hasn't quite happened to the extent where I'm comfortable saying, yes, you said you'd do it and you did it, fantastic, I'm happy I can sit down now. And I guess, in a way, all of this comes at an interesting time for me personally. So my mother is planning some major renovations in the apartment that I live in. And I'm going to have to move out and find something else to do, right? And when I asked her what her plan is for me during this grand plan where she's going to rip out my kitchen and my bathroom and my floor, what's your plan for me, Mum? And she said, Terry, my plan is for you to have a plan. And so what I want you to remember, and the whole point of that story, is that, yeah, sure, she can do that because she knows I'm not going to end up sleeping in my car. I will find a way. But this plan proposes reforms and changes and restructures to a house that I, as a mental health consumer and that mental health carers, cannot move out of. So please be aware of that as you bring in these changes. And as I said, they are promising changes, and I am actually, and it's very weird for me to say this word because I have a problematic relationship with the term hope, but I am hopeful because of this plan. But I still say, thank you very much, it looks great, but ask me again in 2024. Thank you.
Thanks, Terry, and yep, I look forward to asking you in 2024 if the plan has delivered on what we're standing here today and saying that we would like it to achieve. So, good. We want to be accountable. I'd now like to invite the ACT Minister for Mental Health, Shane Rattenbury, to speak.
Well, thanks, Megan, and good afternoon, everybody. It's nice to see you all here today, and to everybody who's watching us online, thanks for joining in. Thank you, Megan, also for the acknowledgement of the traditional custodians, a very important part of knowing the country we live on in the ACT and remembering the significant work we have to do to build true reconciliation in this country. For me, the real strength of this plan is the integration and collaboration that's embedded in it. It's had that from the very start, from the discussions that went on to put it together. I remember the session back at the Hyatt, I guess it was 2 years or so ago now, where a lot of people sitting around talking about, and some of the stories that are actually in the plan are stories that were told right back then and on the day. The collaboration and integration between the government, Capital Health Network and the partner NGOs is critical if this plan is going to succeed. And the fact that we've put it together maximises the chance of that being the case. I was actually at an event on Friday where we were talking about community-based healthcare, and I know a few faces in the room were at that event as well. And one of the areas we were asked about as political candidates, it was an election forum, well, what are you going to do about integration? And I actually cited this plan as an example of the type of integration that we want to see, of having the right people together working to make sure that we structure things in a way that we actually take into account all the perspectives that are needed. I think the plan's very forthright, and today's Canberra Times illustrates just how forthright it is, because it talks very openly about some of the challenges that sit before us to address the shortcomings, the gaps, sometimes the siloed approaches in the mental health system. But I am very encouraged, and I actually quite agree with Terry's analysis of the plan. I think it sets out all the things we want to achieve. It tells us where we need to go. It's got the right launch pad for us to go forward. And that's a great place to be. But I think your question is a fair one of, in 2024, will we have got there? And that will be the assessment, or I guess the judgment point at which we do have to look back and say, well, we started off with great intentions. And I think many of the people in this room will still be working on this in 2024, because I know many of the faces, most of the faces, and I know that everyone in this room is very dedicated to producing a better mental health system. I reckon we'll get a long way. That's my bold prediction. My bold prediction is we won't achieve everything in the plan, because the world will change, things will happen, we'll think of some new ideas along the way. But we've got the right launch pad, I think we've got the right people at the table, we've got the right input, and we've got the desire to get there. For me, the plan and the organisations involved do have a real emphasis on primary care and early intervention, simply by the very nature of Capital Health Network being a key partner and being at the primary end of the spectrum. And Elizabeth made this observation around positive mental health and wellbeing being about much more than clinical services, and it's something that those of you who've heard me speak before will know it's a theme I've spoken a lot over the 4 years of being Minister for Mental Health in the ACT. We cannot simply keep building bigger and bigger inpatient facilities or focusing on the wait times in the emergency department. Those are important things. But if we want our community to be their best selves, to live as independently as possible, to have the best quality of life, then we do need to be making those early interventions and focusing on mental wellbeing as much as mental illness. And in fact, I would say even more so. And I think that this plan lays the foundations for that focus as well. I think it sets out clarity of roles and contributions. We're a small town and we should be able to get this right. And I very much appreciate, from a government point of view, the collaboration we have with the Capital Health Network in a space in which there's only 420,000 Canberrans we need to look after, plus the ones that sneak over the border. But, you know, it's really clear there that we've got our particular roles to play, and I think a document like this, there's always been the goodwill there to have those clear roles, but a plan like this helps us do it even better. So they're the things that I'm pleased about with this plan. I think it really does give us that launch pad to do mental health care in the ACT better than ever. I think we've made progress in the time that I've been in the space. I come to it, as I was very frank when I first came into the role, saying to people, it's not my background. And I appreciate how generous people have been over the last few years in telling me stories, being very forthright about where some of the gaps and challenges are. I think we've made some progress, but I know we've got a lot of distance still to go, and this plan really helps us get on that path. So thank you to everybody who has played a part in developing it. I think probably every person in this room has, and many people online will have played a part. And I ask you now to sort of redouble your commitment in a way and make sure that when Terry asks us the question in 2024, we can all put our hand on our heart and say, we made a pretty damn good job of it. So thanks and good luck with the implementation of the plan, everybody.
Thanks, Minister. That concludes the formal part of the plan launch. We do have some finger food outside, so please help yourself for those that are here. And thank you very much for joining us in the launch of the plan today, and look forward to working with you in its implementation. Thank you.